There might be some immune dysregulation that's actually attacking an early pregnancy or attacking a newly fertilized egg. We don't have all the answers, right? So having these other tools like using the ozone and light therapy for the blood, which I have here in my center, has been able to afford me an opportunity to say, hey, I can dive into that bucket. I have a tool that may help that. I don't know absolutely for sure if that's the problem, but everything else has been tried.
Welcome to the Healing Reset, a podcast where we aim to provide hope and true healing from chronic suffering by talking to experts on how to treat your whole body system, not just your symptoms. Contrary to modern day belief, your body is designed to heal. I'm Jess, your host. Today we have on Dr. Baker. He's the founder of the Healing Sanctuary in Idaho Falls, where they focus on integrative, integrated, and functional health clinic services. Dr. Baker is a board-certified OBGYN, as well as an integrative medicine and functional medicine provider. Today, we're going to focus on infertility. Listeners out there, this conversation will be clinical to a degree, but we understand it can be tender and very triggering. It's important to note that if you're someone who has been dealing with infertility, this podcast is thoughtfully done for you. My own story involves multiple miscarriages, so I can empathetically say that if you feel alone or triggered in your personal struggles, know that we do not have all the answers, but we do have hope in your body's ability to restore and find health. All right, Dr. Baker, welcome to the show.
Thank you, Jess.
Can you give us a quick rundown on your career shift, or if there was a career shift from conventional, what we like to call allopathic, or what America is used to as modern medicine, to an integrative approach for patient care?
Thank you very much for having this opportunity to share my experience, and hopefully it will help anybody out there that might be checking this out. Just a brief background, like you said, I'm an obstetrician gynecologist. I've been doing it for over 30 years, approaching 31 years of doing that. I'm still actively doing obstetrics and gynecology.
Does that mean you're still delivering babies?
Yes, I have one in labor today.
So that's awesome.
So there's going to be a time when I'm going to stop. So
fair.
I'm not going to do it forever. So there is a timeline that in the near future I'll probably stop doing the delivery part. But it's kind of interesting. Everybody has their journey and their story, and mine probably started in around the year 2000 with my oldest child, and at the time, he was in high school. He started developing some OCD tendencies, and it was really starting to affect his daily life, his ability to function, and was really causing quite an effect on him. And in the end, what my wife and I ended up doing, we tried our best to try to help support him and talk to him a lot. It was quite severe at the time, and so I just started opening up my mind because I know the medications weren't helping, and we weren't really excited about using medications, to be honest. And I saw a conference about OCD, and of course, as an obstetrician gynecologist, we don't really get a lot of training in that. And I thought I need to go learn some more about that. And so I went to this conference, and I was kind of blown away because I'm a conventional medicine trained physician. And the conference, surprising, was not really about medications. It was about nutritional causes or deficiencies and or toxins that could be causing OCD. So I was a little blown away about it. I wasn't really sure about the truthfulness of it, but case after case of different presentations that were made there, it kind of just opened up my mind. So I decided at that time I needed to look into it further. So I ended up seeing some other conferences and opportunities. And so I went out in the American Holistic Medical Association, went to some of their conferences, and just started to just attend a lot of these different conferences over the next couple of years. And then I decided I just needed to be all in because I really liked what I heard. I just saw hundreds, if not thousands, of physicians like myself that were just kind of disgruntled with the path that they've been trained, and how we were just symptom treaters and we weren't really getting rid of the problem.
Recently, I'd interviewed someone who said modern day medicine is management, and management of symptoms is depressing. You're never getting someone better. You're just managing.
Yeah. And I just really liked what I heard. It just felt right in my heart. I also liked the term, if you would, or the definition, if you would, of being a healer, because that's really what I wanted to do when I went into medicine. I wanted to help people get better, and I wanted to heal people. And so it was used a lot in those conferences and sessions. And so, that's what I did. So I ended up getting certified by the American Holistic Medical Association. And then I said, that's not enough. And so I went and got certified by the Institute of Functional Medicine and did their training course. So I'm a certified practitioner for that. And I said, that's not enough. And so I did an integrative fellowship with Dr. Andy Weil down in Tucson, Arizona. And I said, that's not enough. And so I ended up taking my board certification in integrative functional medicine. And I passed my boards, quite a few years ago. And so I wanted to make sure that I had not just gone to a conference on a weekend and said, now I can do integrative medicine. I wanted to make sure I had as much certification process and board certification to be able to say that I've done a lot of training. So it took me about 10 or 12 years to do all that.
But during that 10 to 12 years, is that something that you slowly trickled into your conventional practice, or was there a hard stop?
No, yeah, I slowly started, obviously testing it and trying it on patients. That's medicine, practice of medicine. I started using some supplements and things like that. And in my practice that I had actually created, which had gone into a big, huge practice with a lot of physicians, I started bringing in supplements, and the other nurse practitioners and midwives and stuff were starting to realize, hey, these things work for people.
Yeah.
But in the end, I couldn't accomplish what I really wanted to do. And that's when I decided to break off from my practice that I created. And 4 years ago, I started the Healing Sanctuary. And so the intent was to create a place of healing and a place where time is spent with patients to help really try to identify as best we can. And we can't always, but at least think outside of the box, if you would, and strive for kind of direction. I call it digging deeper into possible causes and then different treatments. And then, I still do conventional medicine. I do surgery. I still do those things. I just try to use the best of all worlds, right? Mm-hmm. And I really like the Ayurvedic medicine. I wish I could be better at that. So I did some training in India for Ayurvedic medicine. I don't use it as much as I'd like, so I just don't have time to kind of perfect that and kind of, polish the stone, so to speak, or sharpen the saw. But it's just good to have a little bit of those things. Sometimes I look at myself as being a jack of all trades, but a master of none sometimes. But, it's been good. It's been enjoyable. There's a lot of things that I see and do now that I know there's no way I could have done back in the years. I just would have said, go see someone else, go see a specialist. I can't help you. I have no idea what's causing this problem or whatever it might be. And nowadays, I'm able to manage and take care of most of the people that come to see me. So,
what I really appreciate about your earlier statement is we're oftentimes polarized or stuck in almost political health, where it's like, I'm in conventional medicine, I'm in alternative medicine, I'm stuck in this track, versus thinking an integrative approach where we just need to focus on healing. And that's where the Healing Reset was born. How do we look at your body and get it to heal through multiple different modalities or styles of medicine? We just need to look at you as an individual and understand what's going to make you tick to get your body back into balance. And so that just reading your bio there, when it talks about not only integrative, but integrated, we're really just trying to find the best match for your body and to figure out what's going on.
Yeah, some people, let me just mention, some people, like, when they get into this space, it's like, I'm all against, prescriptions and all that kind of stuff. And that's not really the case. I mean, I do like to try to get patients off prescriptions, but, sometimes you just need them. Sometimes you can't heal or repair the damage that's been done. I mean, I take a couple prescriptions myself. So, I take a lot of supplements too, but I think that's just the goal is to try to find that balance in that person's health that will give them the best health, relieve them of the symptoms that they're experiencing, and improve their quality of life and maybe extend their life if that's what their goal is. I mean, that's basically it. And because I think everybody's goal, and your goal, I'm sure, is to find joy, peace, and happiness in their life.
Yeah.
And when you're not feeling healthy, that kind of undermines that goal, right? Whether that be physical health, mental, spiritual, emotional, those are the things that I think that we have to think about when we're trying to really help in the healing process.
Yeah. Now that gets us into the healing process that's surrounded by infertility, which is a label We talk a lot about diagnosis and how it can be very confining when you actually have a diagnosis stamped on you. So when I think through the term infertility, it's very definite. You're not fertile. You're not going to be able to have a baby. I guess what I want to know from you is, how does someone receive that label in terms of length of time to conception or a number of miscarriages? And how do you walk through that with a woman or a couple sitting in front of you?
Yeah. So basically, it's 12 months. I mean, by definition, it's 12 months of actively trying to conceive. That's kind of the definition. When a couple presents to me, the process is like, okay, how long have you guys been trying? And I don't necessarily have it like a line in the sand. I won't see until you're 12 months. It's like, no, there's some couples, they recognize there's something not right, even if it's been 3 months or 6 months. Like if a woman is not having periods, she's not going to be fertile, right? So she doesn't have to wait 12 months to go see someone to start the workup, right? So when the patient presents and the couple presents, basically you have to think about, is it a female or male related thing? And over my career, it's interesting. It's become, when I first started, it was all just female related. It was like, no, that's what you focus on. Of course, I was trained in OBGYN, but we mainly just focused on the women. But as my career has progressed, it's interesting to see that there's more and more male infertility. There's a lot of problems with sperm. There's a lot of problems with motility and count, as well as, things that can be affecting that. So that's become more of an issue actually than I think on the female side of things that I've seen has kind of shifted. But as far as the workup for infertility, we obviously look at all the conventional stuff. We look at hormone, we look at hormone imbalances, we look at ovulation and ovulatory dysfunction. And then we look at other possible, things such as endometriosis, scarring, things like that, damage that might be occurred, anatomical things that may be affecting the fertility. We look at the semen analysis on men. So these are the things that we kind of look at as we pull those things together. There's some blood testing as well that sometimes that we will look at as far as immune modulators that might be affecting a woman's fertility. And it is interesting that some of the more recent literature seems to indicate that some of these women who have ovulatory dysfunction, who aren't ovulating as healthily, perhaps, or as regularly as should be or as programmed, that this might be more like an autoimmune type of an effect. That PCOS, and a lot of women hear, oh, you have PCOS. And I don't really like that term, polycystic ovarian syndrome. I think it's a garbage term that a lot of physicians use to make themselves look smart and just to be able to tell a lady, oh, you have PCOS, that's why you're not getting pregnant. It's like, well, I don't like that. I think you have to dig deeper and figure out why maybe they aren't ovulating regularly or why they have dysfunctional ovulation patterns. But anyway, some of the research seems to indicate that there might be some actual ovarian antibodies that the body might be actually acting against those ovaries and causing dysfunction, which has sometimes also been found with sperm as well. So it kind of falls into that, what we call autoimmune bucket, right? And so that's a bucket that I think that a lot of conventional doctors don't really look into. We do have some typical therapies that we do for patients who come in with infertility. We follow certain guidelines. The interesting thing is that many of the couples will go through this, and a lot of the providers will know how to do this process. The most common knee-jerk reaction is, I'm going to put you on Clomid, I'm going to put you on Femara, which are kind of ovulation-inducing medications for the women. And there's nothing wrong with that. I don't think there's anything wrong with that, because that might work for that couple. But it's the most common knee-jerk reaction because it is a little difficult sometimes digging into infertility and the different root causes. But there are some simple testing that can be done that can sometimes be very helpful. The thing that's interesting is that a lot of times when a physician has a couple that's been trying for a long time, the workup has been done, the typical lab testing, the thyroid, and all those things have been checked, they're still not conceiving. The most common thing is then, and this is what I used to do, is like, you need to do in vitro fertilization. I'm sorry, you've reached your limit. And I still have patients at times that I have to recommend that. But with the training and experience that I now have, I'm able to offer other things before that. And for most couples, that's a very expensive endeavor, right? It's like $20,000 type of investment, right? It is good. Of course, it's great to have that option. And it helps to kind of rule out ovarian quality. That's what IVF really helps with. What is the quality of those ovaries? And that sometimes is an issue, but it's nice to have that option. But there are other options for women. And that's some of the things that I've been able to learn and use with some of my patients who have presented with infertility. And with some of my training, I'm able to kind of think outside the box. You've had all the conventional workup. Nothing's working. You've been on medication. You're not getting pregnant. The sperm count's fine. What's next, right? And that's where I will use treatments to help with immune dysfunction. And it's not that I have to have a test that demonstrates that. I just need to know that they've kind of ruled out all the common things. And so I start to address that bucket, more of an autoimmune bucket.
And I would like to talk about buckets here in a second, but before they come to you, oftentimes have they been to multiple doctors? Is it usually a conventional medicine and then, hey, we want a second opinion, or we want to walk along someone else while we walk alongside our conventional doctor? Or do you generally get someone in the beginning of their journey, or is it mixed?
It's a mix. I mean, I don't really get a lot of referrals. Integrative functional medicine doctors, at least in my area, there's not very many. There's only a couple. People don't refer to those individuals. It's more like word of mouth. And so I get some that come just from my patient database. And then I get others that just like they've heard about me and they've come and they kind of want a second opinion. It's not very often that I actually walk them along with another practitioner's therapeutic plan. Mm-hmm. They usually just come because nothing's worked for them, or they heard a friend of something that I did that seemed to help, with those kind of things. So.
You look at a flow chart of conventional treatment, right? You start here, you maybe go to prescription drugs, you maybe go to analysis of your uterus, whatever that looks like. Your flow chart might look a little different, but it all stems from potential 21st century reasons why our bodies are struggling with reproduction, right? And that, I would assume, is where you get your buckets. Women and men will fall in these buckets of stress, body burden, their toxic load. Is that kind of where you're going of, we need to figure out from what bucket you're in, how to heal? And if that's the case, what are your buckets? Why do you think humbly that we're in this place where infertility seems to be more common? I'm not sure if that's truth, but it seems to be more common.
Yeah. And Jess, I think you bring up some good points, and you mentioned some of the buckets. And in the conventional medicine model, we have only a few. We have like hormones, and that's about it, right? Yeah. They don't really look into infection for infertility. They don't look into the toxin bucket. They don't look into mineral or vitamin deficiency. They don't look into the autoimmune bucket. And so I may not be able to pinpoint down the real bucket, but I know that the other buckets have been ruled out, usually by the time I see them or I talk to them or I get their history. It's like, yeah, all of those, the thyroid hormones are awesome. Looks like your ovarian function seems to be working well. The sperm count's good. You failed ovulation inducing drugs. And that's where the typical thing is IVF. I mean, you've done everything and you've been trying for 2 or 3 years and I don't know where to go. You've had a hysterosalpingogram where the uterus has been evaluated and the tubes are open. There's no, intrauterine polyps and things like that. That's where a lot of physicians, unfortunately, that they've emptied their toolbox. All their tools has been emptied, and that's where they then say, I don't have the tool for IVF. It's IVF. That's where you need to go.
So before someone goes to IVF, technically that's the last step of the flow chart. They would then seek you or an integrative practitioner who can confidently walk them through dealing with the other buckets, the beginning of the body flow chart, right? Root cause healing. And that's where you come in with some of your tools.
Yes, exactly. Sometimes I'll have patients, like I had a couple this last week that came and they've been doing intrauterine inseminations. And I said, why? I mean, I've done those a lot throughout my career, a lot. And, really the only indication to do that is if the sperm count's marginal. or compromised. And it wasn't. It's just that the practitioner had run out of tools, and that was a tool in his bucket. He could do intrauterine insemination. So, well, let's just give it a try.
Yeah.
And there's no harm in that, right? I'm not trying to fault that, because they have that tool. They don't know. We don't know sometimes all things, right? We don't know sometimes. Sometimes it may work for people, right? But in general, theoretically, that's only used for like marginal sperm. So in my bucket, some of my patients who come to see me, and one thing I think I should mention before we get too far down the line, one of the other kind of categories in infertility is this recurrent miscarriage concept. And that's usually when you have 3 miscarriages in a row and you fall into recurrent miscarriages. And there's a particular workup for that as well. But over the last 4 years, opening my center and having some of these other tools, I've just been able to use these tools. And I'll tell my patients, I'll say either what their infertility, they can't get pregnant, or they can't carry a pregnancy. They've tried all the conventional things from blood thinners to even IVF. And I'll tell them that, hey, there's this bucket of autoimmune. There's this bucket of possible, who knows, parasites, inflammation, infection, who knows, that might cause problems with implantation. There might be some immune dysregulation that's actually attacking an early pregnancy or attacking a newly fertilized egg. We don't have all the answers, right? So having these other tools, like using the ozone and light therapy for the blood, which I have here in my center, has been able to afford me an opportunity to say, hey, I can dive into that bucket. I have a tool that may help that. I don't know absolutely for sure if that's the problem, but everything else has been tried.
You're sitting there speaking with someone who's 2 to 3 years in their journey, coming to you, and you're talking about brand new in their scope of understanding, something that's brand new, and they are right now feeling fairly dismal, I would assume. How do you talk to the skeptic? How do you talk to someone who's like, yeah, but we've tried everything. We've exhausted everything. Yes, we're sitting in front of you, but we're feeling pretty hopeless. How do you speak to that person?
So I just shared my experiences, right? I share some of the patients' experiences. And I think you mentioned in the beginning, nothing's 100%. And I don't guarantee anything that I do. I can't. Life is not like that. But with my experience, I've been able to see some success stories. This is the most difficult part, though. The most difficult part is if I do something and I treat them and I use a tool that they've never used before and it works. Is it like, I don't know, was it going to work anyway? Or did it work because I used that tool to help you? You know what I'm saying? There's no way.
For example, were they destined to carry this pregnancy to term regardless, or did the tool actually help them? And when we speak about the tools, Dr. Baker, can you go through your tools? You said you have 2 different, one's power tools from what I've listened to, and one category is hand tools. Can you describe to the listeners those 2 concepts, power tools and hand tools?
Yeah, so thank you. I just came up with that kind of analogy just to help people understand. So just anybody that's done any tool work, whether it's in the kitchen or in the shop or whatever, we have tools. We have scissors, we have a screwdriver, a hammer, things like that. We have a stapler, or you can have a power hammer. You can have power scissors. You can have a power stapler, right? You can have a power saw. And so I tell people that the power tools typically are more effective. You can get the work done better and faster, but they cost more. If you go down to the hardware store and you want to buy a saw, you can buy a hand saw. And it's going to take a while to build a house with a hand saw, right? Or you can get a power saw and you're going to be so much faster at doing that. It may not be, quality might be the same, but the power tools help you get better faster, but they cost more, right? Hand tools cost less. You have to do them longer, right? So the hand tools might be using like supplements for inflammation, right? To decrease inflammation, or to heal the gut, or to use supplements to help improve ovulation, or uterine lining preparation and things like that. So you can use supplements they're hand tools. It may take months of using those to make a difference. Where if you use a power tool, like my power tools are IV ozone, major autohemotherapy, and UBI or ultraviolet blood irradiation. Those are some of my power tools. Hyperbaric oxygen. Those are some of my power tools, right? IV therapies. You will get perhaps a much quicker response and you'll get down that path of healing faster.
Now, when you look at power tools, and we're saying regardless of the underlying potential toxic burden or autoimmune, we're saying these power tools ideally will help detoxify you and get to that root cause quicker. So how do you describe what that is doing to a patient? I imagine when they hear something like UBI, ultraviolet blood irradiation, they're just like, not sure, never heard that before. And we've addressed it on this podcast in length, so we don't need to go into the science of some of these power tools. However, how are you describing that to a woman saying across from you, saying, if you're ready to do a power tool, this is our next step?
Well, yeah. So even the science behind IV ozone therapy and ultraviolet blood irradiation, we know some things, but there's a lot of things we don't know, right? And so I tell my patients that these tools basically help detoxify the blood, increase oxygenation, improve antioxidant, stem cell proliferation, and immune modulation. And that's the thing that I particularly focus on. I really think that there's some immune dysregulation that happens in these patients with infertility as well as recurrent miscarriages. Obviously, once you've ruled out the other known possible causes, right, there seems to be a refinement in that path. You rule out all these other things. They're not getting pregnant. They're ovulating. Sperm count's good. Everything's good. It kind of narrows you down. It's like, I don't know. You fall in this, unknown. I think that unknown bucket is immune dysregulation. And I have not actually looked into this for over 35 years, but in my medical school training, I actually did research in what they call blocking antibodies. And I don't know what happened to that term. I haven't investigated this. And maybe it's gone by the wayside and studies have ruled this out. But at the time, it was that why is it that women do not abort a pregnancy? Because it's foreign to them. This is a foreign material. Just like an organ transplant, your body's going to reject that. Well, a newly dividing embryo or developing embryo is foreign. Why is it that the woman does not abort those every time? So there is something within the immune system that prevents that. Back in the days, it was called blocking antibodies. These antibodies help block that immune response to attack that developing embryo or that fertilized egg. And so I think what happens, because I've seen this in women who've had successful pregnancies, and then they can never have another one. They have multiple miscarriages. And it's like something's changed. And I think hopefully someday science will figure that out. But I think something has changed. And I think that's my theory anyway, that's my theory, is that this therapy helps that immune dysregulation. And I think that's where I've been able to see some success rates. It's not 100%, right? It will not fix a genetic problem, right? If the embryo or the sperm and the egg, they meet up and they divide, but they divide erroneously, you have a genetic disorder that sometimes is unviable, and properly so, right? And so it won't fix all those things, right? But I think it fixes those immune dysregulations. And I think that's what's happening. I just don't know enough of the science to say this is exactly what's happening at a cellular level, but it seems to help. And then it also seems to help decrease, because I've had some patients where we've done some things where we felt like this is probably more of an infectious source. Nothing that an antibiotic seems to help, but maybe it's a low-grade viral irritation or a parasitic irritation. And I think sometimes that therapy, the power tool of ozone and light therapy, helps to detoxify, improves the immune system, and helps that area of possible infection as a cause for both infertility and possibly recurrent miscarriages.
Now, when you say you think, I know a lot of this can't be grounded in firm science, as you said. However, assumptively, you have a lot of anecdotal experience walking as an OBGYN for multiple years and then looking at the system differently in the past 20 years. What are some stories that can write this out, that can really draw this out for people listening that say, hey, this patient X was struggling with multiple miscarriages or struggling with infertility. We implemented these power tools and now they have a, healthy baby.
Yeah. So I'll give you a little bit of both. So one of the things that's kind of interesting, you go to all these conferences, you hear all the success stories, right? You never hear the bad ones. You never hear the ones that fail. So let me give you some of the success ones and the other ones. So one of the most significant ones was a patient of mine last year that had come to see me for infertility. No, not infertility, for endometriosis. That's what it was. And she had been diagnosed years ago with endometriosis and had just a lot of pelvic pain. She had had 13 miscarriages over the life of their marriage, 7 or 8 years or something like that. And she just basically came to me to say, hey, can you please just do hysterectomy on me? I'm just tired of my periods hurting so much. And every time I get pregnant, I miscarry at 7 weeks. And I just can't handle this anymore. And I said, I will do as you wish, right? Because my goal is to help patients accomplish their goals. And I said, but have we really looked outside of the box, right? So long story short, we did a laparoscopy because it had been a long time. She had endometriosis. We treated it. It wasn't that bad, first of all, okay? She has no problem getting pregnant.
So when you say endometriosis isn't that bad, I just want to clarify for people with endometriosis, her pain was probably extreme, but when you actually were analyzing it inside, it wasn't as severe on a stage, 1 through 4 level.
Oh yeah. It was like half. It wasn't even a 1. It wasn't super significant, but obviously even a small amount of endometriosis can cause a lot of pain and can cause infertility. But I just don't think she wasn't infertile. She had recurrent miscarriages, right? She could easily get pregnant, right? So in the process of doing that, and she was, healing, she got pregnant. And, she was kind of wanting a hysterectomy, but she ends up getting pregnant. She comes to me and says, I'm pregnant. And I says, oh my. And it says, we are going to pull out all the stops. We're going to do everything we can. Are you okay with that? She says, yes. Because she'd done everything. She'd done the blood thinners and she'd done everything with all these miscarriages. And I says, well, we got a tool that might help. I says, I have no idea, but we're going to do it. So we basically did ultraviolet blood irradiation. I said, there's something going on in your blood, I think, that's attacking your pregnancies. And she would miscarry between 7 and 8 weeks every time. And so we did ultraviolet blood irradiation twice a week. I didn't add ozone to it because I was a little nervous about it. I just did ultraviolet blood irradiation. And we did that up until about 12 weeks. Every week we did an ultrasound. Every week we had a heartbeat. And lo and behold, she delivered a full-term pregnancy, right? So after 13 miscarriages, and then this one worked with the treatment, I have to tend to think that was the reason why it worked, right? I can't be sure.
That was a question I did have. Is this a treatment that you're utilizing prior to pregnancy as the lead up or throughout? And so that really answers that question too. For listeners out there, that is something that is coinciding with the pregnancy.
So for her, I only used it when she was pregnant. I have others that have trouble getting pregnant and then also carrying it. So I actually use it for those who have trouble getting pregnant and conceiving, and then I continue that. I've actually changed the protocol to where now I also do ozone with that blood treatment. And so the other side of the coin, I had a pregnancy just this last week. She was not able to get pregnant. We did the therapy. She got pregnant the first month. Okay. And she had not been able to get pregnant for a long time. But unfortunately, the embryo form never got a heartbeat and she miscarried. I'm doing a genetic test on it just to see if that's the reason why. She is one. I have one other one similar, but that patient has a severe rheumatoid arthritis. She's had 3 or 4 miscarriages. We did the therapy once she was pregnant, but she wasn't able to come in as often as I hoped that she could, and she miscarried that pregnancy. All the other ones I've done are all success stories, dozens and dozens, where like I have another patient right now that's about 32 weeks. She'd had 7 miscarriages in a row. They were working on adoption. They had everything ready for adoption. And they've been married, 8 years? Yeah, 8 or 9 years or 10 or something like that. And they came to see me and I just said, I shared the same story. I said, I don't know. I got this patient that had 13. You know, I can't guarantee anything, but this is something that we could do. She is 32 weeks. She's done the therapies. I have another patient right now that's 28 weeks. She had 5 miscarriages. I've had many others with, 5, 7, 6, where we've done those therapies and they've been able to carry those pregnancies and without any problems. So
you're going to have someone listening to this saying, I'm not in Idaho Falls, nor am I even close. How do I get access to this? What's your best advice?
I've thought about that, in the past, Jess, and I don't know where everybody does this. And I don't even know any other OBGYN that even has this as a tool, to be honest with you. I know a few that do this, but they don't practice that, obstetrics anymore. So I'm not aware of anybody that offers this, because if you look into it, they say, you shouldn't really be using ozone therapy in the first trimester. It's kind of a relative contraindication, because there's nothing that's been studied. But if you look at anything, nothing's been studied in pregnancy.
And for those listening, only Dr. Baker's thrown up a lot of air quotes around the term studied, because it is something that there's a lot of studies actually behind it. But as we know, for those of us who have experienced pregnancy, it's something that a lot of times is not quote unquote experimented on. And so when you throw up the air quotes, tons of anecdotal evidence, tons of studies out there, but I'm not sure how many exist in the actual pregnant population.
Yeah, as far as I know, I don't know of any real pregnancy related ones. I know in Cuba that they're using it in pregnancies. I don't know what for, to be honest with you. I need to look into that more. But so for that patient that's like, maybe this is hope. The way I thought about it is that unfortunately you'd have to come to Idaho Falls, Idaho. And we would do those therapies until you get to that 9 to 10 week time period. Typically, if you get past that 9 to 10 weeks, most of the time you're good. There is a small chance of miscarriage, after that in the second trimester, less than 2%. But it's that first trimester higher miscarriage rate that seems to be the biggest hurdle to overcome. Now, once again, I can't guarantee that either, because a lot of these patients, when I've done this, I will tell them the same. Look, we're past the highest risk area. We're past the first trimester. So this is awesome. And they're super excited. But I can't tell them, quit the therapy, continue the therapy. Yeah. Everybody's a little different. Some of them will do it, but not as often, because once again, it's an out-of-pocket expense. And it's not that expensive. Really, when you think about it, it's not that expensive. You're looking at a couple $1,000s, right, to go through the first trimester. And sometimes that's, that it can be very effective, and it's a lot cheaper than $20,000 for IVF. But so my thinking is a person would have to come here. They'd have to stay perhaps a month, because either to help get pregnant, or once they're pregnant, from that 6-week time period, we see fetal cardiac activity, verify that that's good, and then do treatments for 3 to 4 weeks, and getting past that 9-week time period. Then hopefully after that, things will be fine. Using some of the hand tools as well, right? But
now, what I do want to offer patients or listeners out there is the availability to contact you. So we'll put all of that in the show notes. I'd also like you to give out your information, because your sanctuary can support this. The Healing Sanctuary can support people coming in from anywhere. And then I also want to encourage listeners to email us at info@thehealingreset.com. Because if you're in that pre-pregnancy phase, right, experienced infertility, experienced multiple miscarriages, but you're not pregnant right now, there is a list that we can send you of locations, practitioners that can deliver these power tools to you. But per Dr. Baker's, I've completely agree with you. You're kind of unique in how you operate from an OBGYN perspective. That's not something that you find, in your neighborhood. So I want to provide the best of both worlds. And where can they get a hold of you in your clinic?
Yeah. So I think it's great that there's other practitioners like me that actually have been doing this a lot longer than me, as far as using the ozone and light therapy as a tool. I just don't know how many of them are going to touch a pregnant lady. That's the hard thing, right?
Yeah. I think there is that pre-pregnancy we're working on the next, right? Like ultimate health to try to sustain a pregnancy, but your confidence goes beyond that window. It's a very humble confidence. And I appreciate that about your delivery and how you are approaching patients and talking to them, because there is this tenderness around this topic. And so I think when it comes to the actual pregnancy phase, like, thank you on behalf of those of us who have struggled with this for talking to us and looking at it from a body perspective, not just a symptom perspective or the perspective of, this happens, right?
Yeah.
Because a lot of times, and that to a degree can be valid. This is something that does happen, but to sit across from someone and have hope is a very important thing.
Thank you, Jess. And the one thing that you did kind of mention that sparked a little thought, we do have the capability to do telemedicine consults. So I would definitely not want anybody to spend a lot of money to come out to see me face to face. I don't think that's worth it. I would just say, hey, reach out to, I'm happy to talk to you about your story, your journey. That to me is something that's really helped me a lot, is getting the person's story and journey, right? The history to me is so important in identifying really what bucket is broken. Where do we have to fix the bucket to heal the bucket, right? And so a lot of times just sitting down and getting that person's history can be very telling, and I can give them some guidance. So a telemedicine, I would definitely say, if you live far away, don't come here. Let's try to gather the data from your story or any other things that you have. And I'm more than happy to share my insights and my experiences and the things that, the weaknesses that we don't know. We don't have all the answers. The human body can be very complex, and fertility is one of those. Unknown infertility, that's a big one. And even the IVF specialists don't have answers to that, right? So telemedicine is where to go to start, and then I can hopefully guide you, and maybe you can find someone in your neighborhood or your area that maybe would consider doing these things for you. But if not, we would be open arms here to welcome you, and hopefully it will work. Once again, it's not 100%, but so far it's been encouraging, and I'm excited about it for those couples who come to see me and seeing the success. It's just really fun to see.
Well, thank you so much for sharing. And to segue into our ending segment, Dr. Baker, you see everything, not just OBGYN as a category. So you're seeing autoimmune, you're seeing the gamut of chronic illness. Can you just relay to listeners 3 things that you think today would help them get better health? And so someone out there, just like 3 things they can implement after they shut off this podcast moving forward that would help get them onto a journey of good health.
Oh, great question. I think number 1, and this goes back to my Ayurvedic training, if a person can't figure out what's going wrong, a doctor or even yourself, start with the gut, start with the GI system. So number 1, look and focus on what you're eating and what your digestion is like, what your elimination is like, okay? And really try to improve that, okay? I think number 2 would be, you need to have this balance in your life, right? Balance of stress, work, home, family, relationships. You've got to seek a balance that brings joy and happiness. That's really what it's all about. That's what life is about. People get addictions and do things like that. They don't do it to hurt. They do it because they're hurting inside, right? And they want to try to find peace and happiness. And so find that in your life, whether that be meditation, whether that be running, find that balance in your life that can then give you that mental and emotional strength and fortitude to go on and continue every day. And then I think the third one, if you're eating right, you're balancing your life, you're getting up at the right hour, going to bed at the right hour, eating at the right time. Maybe it's just making sure you have good quality sleep for regeneration and restoration. Maybe that would be done for you.
Yeah. Yeah. Well, we certainly appreciate your time, and you have a baby to deliver today. So on that note, we will let you go, but thank you, Dr. Baker.